Hi, good afternoon. My name is Jared Packard, and I'm the Director of Strategic Partnerships here at the Urban Indigenous Collective. And we're very pleased today to welcome Shanaleigh Mejia, as well as Marcia Dare, who are at the Alliance for Positive Change. So I just wanted to go to introduce you both. And Shanaleigh, you're going to be presenting for us about health insurance and the current open enrollment period. We're very excited to have you here today. And I think because December 15th is approaching very quickly. This is really critical for people who are interested in getting enrolled in health insurance. It's good information for them, and I think this is going to be a good opportunity for them to kind of see what it is that they need to do. So I'll start off with Marcia. She is the Assistant Director for the Linkage to Insurance Program at the Alliance for Positive Change. Welcome, Marcia, and I don't know if you have a few words that you want to say about yourself.
Well, yeah, I'm Marcia there. I've been working at the Alliance for 18 years plus, and I'm currently supervising both programs, the Linkage to Insurance and the New York Care Insurance. So I'm very excited to work with Native America to assist you know, with everybody because we are looking to help everybody who don't have health insurance. So I am glad that Shanaleigh was able to reach out and get, a very good representative program like yours that will help us to further assist, people who are not privileged to have insurance of their own. So thanks.
Thank you, Marcia. And just so you know, I actually reached out to Shanaleigh. So
Oh, it was the other way
yes,
around. Okay,
yes.
sorry. Well,
No, but
Shanaleigh reached out to me, so I just assumed that's it. But I'm sorry. Okay,
no,
that's
it's
fine.
fine. I just wanted,
Thank you.
yes, I want her to get credit for pulling this together. And so
Okay.
Shanaleigh, I'm going to just read a little bit of a bio that you had provided to me. So Shanaleigh Mejia has 12 years experience working with elected officials, stakeholders, local and state agencies as a community advocate. Educating the community on navigating city services and available resources is her passion. At the Alliance for Positive Change, she has mentored the underserved populations who are homeless, have chronic conditions, or those who are reentering the workforce, ready to make changes in their lives. Currently, as the Linkage to Insurance Manager, Shanaleigh is an essential worker, making sure anyone uninsured is getting insured with health insurance to live a long and healthy life. So welcome, Shanaleigh, and I don't know if you have a few words that you want to say to introduce yourself.
Thank you very much for that introduction. And I'm just very thankful to be here, to be a part of your community, to share this great resources that we have. As Marcia mentioned, we are trying to get everyone insured. This is a lot of free information out there, and a lot of people are unaware of it. So I'm very grateful for inviting me to this platform so that we can share that with your community.
Thank you, Shanaleigh. All right, so what we'll do is we'll go ahead and have Shanaleigh provide us with a presentation about health insurance and the current open enrollment period. If you're tuning in and you have any questions, please just feel free to enter them into the chat and we can get to them towards the end. And Shanaleigh, the floor is yours to go ahead and take away.
Okay, thank you. Let me just pull this up. So good afternoon, everyone. So um, once again, we are the Linkage Insurance team at the Alliance, and our goal is always to enroll or for anyone who is underinsured, any small business employees into the New York State of Health marketplace. And our consumers can enroll into Medicaid, essential plans, and Child Health Plus all year round. And that's really important to share because, as Jared has mentioned, in December 15th is coming up, and the state is trying to get everyone enrolled. And with the Medicaid plan, though, that is a plan, and the essential plan, that is something that can always be done beyond the date of December 15th. So that's why I have this part here to share that. The December 15th, though, we do want everyone to be on point with getting insured because the enrollment will start their coverage will not be until January. So if you do it after December 15th, what is going to happen is you will have to wait till February to get coverage. So we're trying to get everyone coverage for the new year. So, but just once again, reiterating that the Medicaid Essential Plan and the Child Health Plus beyond December 15th, you can always enroll at any given time. The other plan that we have is qualified health plans, and that's the one that's available right now during the open enrollment. And those are plans that are people who are at a certain financial aspect. If they're above about $25,000, then they go into a plan called the qualified health plan, and it varies depending on the income. And of course, the special enrollment is due to COVID, the COVID. So what has happened since the COVID, the governor has extended the enrollment. So from January of this year, it was closed down, but then because we went into COVID, then it started opening up, and they have extended it. Probably every month they have extended and extended it. So now that we're in the official period, it's still open, and we will see if they send any new information on Tuesday, the 15th, or before that, to let us know if it's going to be an extension again, since we're still in this time. So now we're going to go into some of our population that we serve, which are homeless individuals, substance users, Asian Pacific Islanders, immigrants, people of color, those living with HIV, and LGBTQ individuals and families. We also assist individuals under the age of 64. Consumers who are not eligible for the marketplace, they are referred to what we are calling the Health and City Hospital for further assistance. So that goes into the same thing for those who are over the age of 64. They will go over to that referral process as well. And we're going to get into that towards the end. So our enrollment process, it takes about 30 minutes or more to determine the eligibility of the application. And it's also depending on what information the person have. If they have all the documents requested, which is usually having your name, you have your social information, and your financial aspect is the most important part. If you have that, that's when the application can go a little faster. But if you don't have those items, the application can take a little longer to complete that. And the financial aspect, because you need to know for the entire year, for instance, where all the places that you have worked, including the location and what was the breakdown of that income per month, per week, or so forth. And it is before taxes that they request that information. So you want to be as accurate as possible when you're filling out that part, because it determines what tier insurance plan that they send you into. And we're going to get into all of it. As we mentioned, you have the Medicaid, you have the essential plan. So with them, it depends on how much your income is. As I mentioned, if you have no income, which one of the brackets that it sends you into. So that's why that's important. So usually at the end of the 30 minutes or 40 minutes, however long the application takes, it can tell you your eligibility right away. It will tell you you were eligible for an essential plan, or you've been eligible for Medicaid, or maybe conditional Medicaid, because that is emergency Medicaid, for instance. So it depends. But the fact that it is very immediate is what is really great, that you can get that right away. And it will tell you if there's additional information that is needed within the application. So for instance, proof of immigration status. We actually don't ask for that up front. That is usually just you provide me with where you are on the immigration spectrum. If you are someone who is a visa holder or naturalized citizen or U.S. citizen, you tell us where you are, and that determines what information you provide. And we will just ask at first, what is perhaps your passport number? You can provide that to me verbally, and then I input that information. At the end of the application, if the state requests actual proof, then that eligibility will say that at the end. We are looking for proof of immigration, or we are looking for proof of the income that you stated within the application, so that we can have actual verification. And the only reason they're asking for the immigration process or the income, once again, is to decide what insurance plan you are to go into. For those who don't have any documentation, let's say, for instance, you lost all your documentation, it could have been a fire, or you just lost your wallet, whatever the case is, then you go into getting something called an emergency Medicaid. So that is kind of a conditional Medicaid service that you will get provided. That means you can only go to the doctor in case of an emergency. So with that one is a limited insurance plan, but the point is, you can still get that insurance plan. And that one too, if you also you have immigrants that are here and they have expired documentation, they can also get that service as well. And it will be for an emergency only. So that's where the two criteria is for that emergency part. But what is great is if they have, if the immigrant, for instance, have passport and visas that are valid still, have not been expired, they can get into a plan called the Essential Plan. And so that's great because they have managed care with it as well. So one of the managed cares that we know within New York is, for instance, Health First, Fidelis, um, Metro Plus, and a lot of the other plans that I will share at the end. So that's one of the good things, that the immigrants can have a passport, valid visa, that they can get full coverage. So that means there's no condition. They can go to the doctor as long as the doctor is within the network of the insurance plan. They can go to the doctor within New York. And of course, it depends. If you are upstate New York, you have different coverage that is different than down here within the 5 boroughs. But the fact that they have full coverage is something that we definitely want to, for you to at least take away from this presentation today, that it is possible. Um, and all your information that you have within, if they're asking for the immigration, as we mentioned, or the proof of income, all that information stays within the New York State of Health database. It does not get sent to any other governmental agencies. And that's something that they actually have us read at the end of the application, so that for the immigrants, they are also to kind of ease their anxiety if they are afraid of doing their application at times. So we always share actually that information at the very, very beginning. And another great thing is, if you have someone visiting, for instance, here in New York, they're also eligible to get this insurance, providing a New York address. So that's something that's good to know. Someone is here visiting for a time and they need to go to the doctor, that they can get that coverage as well. We, of course, due to this COVID right now, we are providing a lot of information over the phone, so they do not need to come into the office. We do have our on-site facilities that is available, but we are kind of on a schedule based on when we go into the office, so that it is best for them to contact us so that we can inform them of completing the application. We also have a language line, which is great. So we are able to assist anyone with any language to complete the application if they do not have someone to assist them with the translation. So that's also one of the great things with New York State of Health. And for the American Indian and Alaska Native, there is actually a section within the application where you can identify yourself as that. And it actually asks you for your tribal information. So if you are any of these tribes up here, you can actually select that, and your application will then be determined on, for instance, perhaps you may not pay a premium. If some of the insurance plan, depending on your income, you are still paying an income premium. So that's a monthly payment that you need to pay. And because of your nationality, if you are American Indian or Alaska Native, it may eliminate that option. And also co-pays when you go to the doctor, it may also eliminate that for you if you're one of these tribes. If one of the tribes you're part of is not up here, then you will just apply as a regular applicant. And even though you may still put in the application that you are of one of these tribes, it still all depends on what your, once again, everything is back to your income, on what your income is. And there's kind of a breakdown within the system as to if someone is 200 FPL below poverty line, or if they're above it. And that meaning, for instance, you're 17,800 or 700, roughly about that, that will put you into the bracket of Medicaid, or it could put you into the bracket of an essential plan. And then there are 4 tiers within the essential plans, 1, 2, 3, and 4. And so it determines on where you land in that. And for those essential plans, you can either make no payments based on the income, or you may pay a substantial amount, a small amount. So something from $20 for a regular medical, just a doctor visit. And then if you want dental and vision, then it may be about $44 monthly that you may pay. But once again, all that determines on the income that you have. But that is why, as I mentioned before, they're asking about what is your immigration status and how much money you make, because those 5 categories are different in and how they would and where they would place you into the application. So that is the only reason why they're asking for actual proof and verification in the information that you're sharing. And this is the website that we use, which is the New York State of Health.gov website. It's called the Marketplace. As a lot of you may not be aware, but you can go on the website and it actually gives you a quote. So you can actually do a quote on the website if you would like as well. And of course, but calling one of us is always best, myself or Marcia. That way we can answer all the questions that you have. And also, it's a little better too because we're able to provide you assistance with some of the items that you will need, like giving that in terms of the coding and so forth. We can kind of tell you like where you may land within your application. Marcia, you want to chime in and share something?
No, I was just gonna say, even with the I-94 number, like there, most time people don't have it in their passport, but as long as they can provide us with the passport number, the expiration date, we can get the I-94 number for them. We can apply for it and get it in order to make them eligible for our essential plan. So that's more than emergency Medicaid. So we always try push for the best for the client so they can be better served, because once they have an essential plan, they can afford to just go to a doctor that takes their insurance and go on a regular basis rather than emergency Medicaid that you only can serve on an emergency basis. So yes, um, yeah, we try to get them the best plan. We are not really supposed to tell them which insurance is best from, because all of them all depends on your medical care, but we usually go through and explain the different plans and what the benefits are. So that's what we do. But it's not one plaster fit everybody. We have to do it individually depending on the need of the client. So yeah.
Mm-hmm. Thank you for that, Marcia. And that's actually a great point that you brought up in terms of that plan option that yes, the client gets to make the decision of all the plans, like I mentioned before, depending if you are upstate New York, Albany, and those areas, there's different coverages that is there for you that will cover your area. But if you're in the local 5 boroughs, then you have, more options. And wherever they are in New York, though, they get to select the plan that they would like. And so, once again, I just wanted to reiterate this part in terms of who are not eligible for the New York State, and that is Medicare recipients, unless they have a child who is under the age of 18, then of course they can be within the New York State of Health. But if not, and if they're over the age of 65, then no, we cannot assist them with the state at least. And the third thing is, if an immigrant, for instance, there are some folks who are here and they are working and they are making almost over $30,000, they are also not eligible for the New York State of Health because of the income that they are having is over that FPL, as I was mentioning before. To be under emergency Medicaid, you either have to be below 17,600 or no income at all. So any immigrant, this is where they get referred over to the Health and City Hospital. That's the other program that we have as well. So basically, with the New York State, you can get a lot of variations in terms of where you can fall, and we also are going to assist them with going to the next phase if they don't get it here, or even if they can't afford it, because not everyone can afford when it goes into, as I was mentioning earlier, the QHP, which is the Qualified Health Plan. That's the financial one. That those plans can go a little higher. Those are platinum, gold, and silver plans. So those premiums tend to be higher, as well as the copays. But once again, that's because of the income bracket that they're in. But if someone do say that they're unable to afford that, once again, we do the referral over to the HAC program to assist them. And as we were mentioning, these are all the health options that are within the local 5 boroughs. As I mentioned, upstate, they have other special plans that are up that side. But once we complete the application, all of that would be available to the person to determine what coverage is upstate New York, for instance. And these are all the local ones that are here. that they can select and choose. And another great thing is if it's a Medicaid recipient, the Medicaid recipient, they have 90 days to confirm if they want to remain in an essential in the plan. Let's say, for instance, they choose Health First, but then in 90 days, for some reason, they don't feel like they're getting the services that they need. Health First doesn't have a specialty care that they would want. They have the ability to switch from out of Health First and go into Affinity or Emblem or any of the other plans, but it's within 90 days. With the Essential plan, they have no limits. They can in and out of a plan if they choose that. Once again, they're not receiving the care that they need. So that's always something that we like to share with clients when they're saying, well, I'm unsure about what insurance
Right.
plan that they would want to go into. There's also a quality rating at the that gives the what other clients have also shared about the insurance plan. So we usually provide them with that information, like, okay, well, so far in your area, a quality rating for this insurance plan may be 4 stars, 3 stars, 2 stars, whatever the case may be. And we share that with them so that that can assist them with helping making the determination. But we also tell them to, if they already have a doctor, then just contact your doctor and find out what insurance plan
Correct.
that your doctor takes. That way they can remain with their doctors. We know some folks there with their doctors years and they want to remain with that particular physician. So we always make that be the first thing that they do to, once again, making sure that they're staying within their provider's network. And then if they choose to say they want to go someplace new, then they have an option from all these various managed care insurance plans. So something that was before we have the new election that took place, something that was another fear factor for immigrants was the public charge facts. And so basically that meant anyone who was an immigrant and they were going to be put into a federal plan. For instance, federal plans would meaning if they had Medicaid, the federal Medicaid, then that would be something that they could be attacked as a public charge and will not be able to change their status while they're here. So right now they were back and forth with this public charge fact, but right now, due to the new administration that are coming in, there seem to be taking this out, that this will not be a factor. Of course, we still need to have the confirmation after the new president get in office and confirm everything. But so this is a good thing to know because right now, if someone do happen to they're changing their immigration status and they may be placed, for instance, into a federal plan, then they will not be affected by this. They can continue to complete their change of immigration. And so before, this was very important to have a conversation because this would affect a lot of people, right? For those immigrants that are here. And what happened is, at least within here in New York, with this plan, we would always making sure that when we are entering their information, that the information that they're providing is always accurate, making sure we put it in the right place. Because the emergency Medicaid, for instance, because people heard Medicaid, they know that Medicaid is a federal plan. They assume that the emergency Medicaid was also a federal plan, and it's not. The emergency Medicaid is actually a state plan. So that's why they were able to enroll into that one. And like as we said, get additional service if they can go, if they can provide their passport information, they can go into the full coverage with one of the essential plans. So now that some folks, though, depending on where they are in their immigration status, it may change their eligibility to go into one of those federal plans because they're becoming a permanent resident, for instance. So with that, it's alleviating, as we mentioned, the anxiety that people were having, and always making sure that we are on top of the changes that was constantly going on within the last couple of months. With yes, the public charge was in play, and no, then it was not in play. And another thing too, people were also concerned if they were getting, let's say they do have an American-born child here, but they're the immigrant and they may have went to get food stamps or cash assistance for the child. If, for instance, if they would be affected, no, they would not be affected because it's not for them. Even though they may be the head of household for applying for the public assistance, it would still be for the child. It's under the child, for the American-born child that is here, that is receiving it. So that's also something that they would not be affected if they were in that category. And we definitely wanted to kind of make that point very crucial, because some folks were not going to get assistance because they were afraid. And so that was something we wanted to make sure that that message was clear, that yes, don't stop getting services, don't go cut your services because you're hearing about this ruling. You are not affected, once again, if it's not, even though you are maybe the head of household, because you have your children that are American born, they can still receive the services that they can. But once again, it's changing over with the new president that is coming in play. So we will just continue to listen out and update the community as soon as we get final words on everything. So into the New York State, the other program now, that was a state. So now we're taking you locally to the city. So this is the New York Health and Hospital New York Cares program. And this is for those, once again, low cost or no cost services that is provided. And this is for those who do not qualify or cannot afford insurance based on the federal guidelines through the New York State. So just wanted to point out that everyone who comes to us, we do an application with the state first. Once the state provides an eligibility for us, that's when, if we see that they are not eligible or they only get a substantial small amount of service, if they're emergency Medicaid, for instance, within the state, then we make the referral over to the city. So that's always important to know. And this is based, once again, on the person's income and household size. This one is based on a sliding fee. So determining on where they are on the financial spectrum, again, they will meet with a financial advisor who would go over what the cost may be. And this one, like I mentioned, I kept saying it's not an insurance plan, for instance, but it's a program, because this is how they're calling it. It's a program, but coverage is provided for their doctor visits and so forth, specialty care, and all the, practically the same way if they had an insurance with the state. It's providing the same item for those who are at the city location. So you can have, once again, your primary care provider. You get an appointment with speaking to a financial advisor, and then you go in to see a primary care. And of course, due to the COVID, it may be longer than the 2 weeks, but at least they're trying to speed up that process in terms of getting you a primary care appointment right away. It's comprehensive, preventive, and any specialty, behavioral health care, all the same aspects of if someone was with the New York State full insurance plan. You can call their member service hotline, which is also 24/7, to get an appointment or anything of the sort. And you also have your prescription drugs that is also covered by that. And the fee is very minimal for them as well when you're going to doctor visits. So one good thing is you're only paying this fee when you go to the doctor. With the state, as you know, if you are on a plan, in one of the managed care plan that is a premium every month, you need to pay that whether you go to the doctor or not, so that you can receive and keep your coverage. I also wanted to mention with the state, and there's certain parts where if you don't, you have some grace period if you lapse in your payment, but you need to definitely make your payment no more than at least a month late, because then you can go lapse in coverage. And sometimes, depending on where you are on the spectrum, if you are a qualified health plan, for instance, you may not be able to enroll again until the open enrollment reopen. So that means right now, we are in December, right? Someone goes and start paying January and February, and something happens, lose their job or something, and then they miss the payment for March, and then they miss again for April. They may tell you you didn't pay for 2 months. So now you may not be eligible to get into a plan again until open enrollment reopens again back in November. So we just also always want to have those conversations with our consumers to let them know, try to be on to making sure that you're always making your payments, okay? So eligibility, once again, I was mentioning here, your emergency Medicaid. Oh, so what's the great thing is you can have state emergency Medicaid and you can get the HHC to see your primary care physician. So you have dual. That's a good thing about that part. And it's good because let's say you are at the city level at one of the city hospitals and you are you need to get a specialty surgery. You present your emergency Medicaid card from the state that will pay for that. Because remember, as I said, here at the city level, you are paying a minimal fee, but for that specialty that specialty surgery that you need to do, you will still need to pay a portion of that. So because of that, having the emergency Medicaid with the state will combine two coverages for you so that you don't have to come out of pocket. And once again, this is for those who are living in the 5 boroughs: Brooklyn, Manhattan, Bronx, Queens, and Staten Island. And you have to be here for the last 6 months, within 6 months. So for instance, we stated with the state, someone had to, as soon as they come here, they are eligible to apply. But with the city, you have to be in New York for at least 6 months before you can apply for their program to get coverage.
I have a question.
Yes.
So on that number 3, it says insurance is considered unaffordable if the premium is more than 8% of the individual's income. Is that gross income or is that take-home pay?
That'll be the gross income that they go by.
Okay.
Yeah, it'll be.
And that's annual premium or monthly? Is it monthly or annual? I guess it's the same thing.
No, remember, the city, you only pay when you go to the doctor.
Oh, okay.
The charge that they are going to give to you is based on that gross pay that you present to them when you sit first with the financial advisor.
Okay, great. Thank you.
So if that means if you don't go to the doctor for 6 months, you have no payment to make until you go and visit the doctor here at the city level. At the state, if you're with the state and you have monthly premiums, then that you'll be paying every month, whether you go to the doctor or not, because you have to stay to maintain your coverage for the year.
Okay, thank you.
No problem. So once again, the cost here is, as I was mentioning, they sit with you in the beginning so that they can kind of go over that aspect with you in terms of what the charges may be based on the out-of-pocket costs for some of the hospital services that they provide. And here are the locations that they have for a city. So we have Coney Island, we have Elmhurst, we have Harlem, Lincoln in the Bronx, Metropolitan, Bellevue, Jacoby, Kings County. So in practically all the different boroughs, they have a location that is a city location. So now with these city locations, this means these are the only locations that you can go to. You cannot go outside of this network to go see a physician. So that's the only, I want to say, thing about this in terms of having the city one. With the state, of course, you can go to any doctor within the network, wherever they are. However, here, it's only at these locations you can go to. And of course, you can still jump around. Say you're in Queens one night, go to Queens. You're in Bronx another day, and something happens. Yes, you can go to this Bronx location, but it have to be one of these specific Bronx locations, such as Lincoln or Jacoby. Basically your information is looped into the system. So this is why it didn't matter exactly where you went to one of these locations. And this program actually just came about this year by de Blasio. And this was, once again, for where they're seeing the lacking of not everyone may be able to get the insurance, through the state. So they were putting other items in place so that everyone can be fully covered. So with this plan, this is why you see sometimes some of the locations at different points, because they started at one particular borough. For instance, like it was started with the Bronx first only. That was only location before they moved on to Brooklyn and then spread out to the other boroughs. This is the website that anyone can go to in terms of finding the locations, the doctors. This is the hotline number up here to make an appointment on your own as well. But once again, call us so that we can assist you with making the referral process a little easier, because calling the 1-800 number, I'm going to say for both of them, can be a little tedious at times. So contacting us will be able to move the process on a little faster. And here, this is just more information about the plan. This actually logo here at the bottom that says NYC Care. That's actually what the card looks like when they send it to you once you're with the city. With your name on it.
We should give our logo, our flyers out, Shanaleigh, with our information.
Okay, yeah,
Not
Jared
the,
is going to share that
yeah.
at the end.
Mm-hmm.
Okay. And of course, the city also still takes all these different um, plans as well, the managed care plans too. So just know with the state, you can go to a city hospital as well with your managed care plan. And so just a recap in terms of the comparison with New York State versus the HHC program. So once again, with the marketplace, consumer can enroll as they arrive in New York. So that you get off the plane, you get off that bus, don't matter. You can apply right away. But with the city program, you have to be in New York for 6 months before you can go to them to get service. Once again, for marketplace, it's 64 years and younger that we assist an applicant. With the city program, it's helping anyone over the age of 18. So usually not for kids with the city program. So once again, still got to revert back to the state. So this is where I'm saying both of them are like kind of hand in hand, because the state is do the children, the city does not, but they assist everyone as well, and including those who are over the age of 64 that the state does not accept. They can also receive services at the city. Remember that the same Medicare recipients have to have a dependent to get service with the state. If not, they cannot get service through the New York State marketplace. The HAC program, it's only hospitals within the 5 boroughs, and the recipients are either emergency Medicaid recipients or they cannot afford the insurance plan through the state. And that's something good too, because we can actually send the eligibility information over to the city so that they can prove that the person is not eligible for the state. And of course, with the managed care plan to the New York State, once again, you can go to any of the doctors or facilities that is within the network. And here is our contact information. So, Jared, did you have a question for us?
Yes, I do. So actually, this is a great place. We're going to leave this page up because I think this is really important for people to have an opportunity to write your numbers down. You see Marcia is at 646-418-8568. Shanaleigh is at 917-699-3318. And then the other two numbers are for people that you can also reach out to. And so basically, I just had a few questions. I think you kind of answered some of these already in your presentation. And first of all, thank you so much for that presentation, because that was very detailed. And it was, I wish I would have known this last year myself. But this
When we
is
met,
great.
you were working out some stuff.
I was still working out some things. So, but now I'm covered, I'm good. But yeah, so I wanted to know, what can our listeners do right this moment? So today it's December 11th, Friday. I really is curious. So the 15th is next week, next Tuesday. So are people able to call over the weekend, or is it something they have to do Monday through Friday, 9 to 5?
Well, we are available Monday and Tuesday.
Okay.
Unless it's a special circumstances, then we wouldn't mind doing early.
No, Saturday.
Early Saturday,
Yeah.
but it needs to be before 1 p.m. because
Okay.
the marketplace closes at 1 p.m.
On Tuesday, you said?
on Saturday.
On Saturday. Okay, so if it is on the weekend, okay, great. So what can our listeners do right now in order to meet this deadline? So the deadline, again, if you could just re-explain it for us. This just means that, sorry, go ahead.
Yeah, so the deadline on Tuesday is so that the coverage can start January 1st. If you do not get it complete by December 15th, then you will have to wait an additional month. So that means February. So if you do your application December 16th or anytime after, but it has to be before the 15th again. So from the 16th to January 15th, your insurance plan coverage will not start until February 1st. But if you get it complete by December 15th, then your coverage can start January 1st. So that's why we're just trying to get everyone covered so that there's not a long wait that you have to wait to get coverage.
Okay. And is there waiting times? Like, what are the average waiting times if, somebody were to call you, let's say on Monday? How long can they expect to wait before they receive some assistance?
we try to get everyone the same day, or as if
Okay.
I'm not in the middle of an application at that time, it will be done right there on the spot.
Okay, great. So it's almost it's first come first serve, I guess, too.
Yes, it is. And that's why
Okay.
I wanted to make sure I put all four of our contact information. And also for us, we will also share, hey, I can't get to this person right now. Can you do it? So it's a great team in terms of making sure we do immediate service right away.
Okay, great.
We're not missing anybody. So yeah.
Okay, great. Awesome. Thank you. And so I know that you spoke a little bit about people that are enrolled in federally recognized tribes. So you said that on the New York State of Health, there's an option for those who are enrolled in New York State federally recognized tribes to select those options, correct?
Yes.
Okay.
Correct.
And is there any other place during this application process for people that are not New York State federally recognized tribes or state recognized tribes that they do? I mean, is there any benefit basically to being an enrolled member in terms of signing up?
If they're not a part of the tribe,
So if they're not part of a New York State tribe?
if they're not, there will be a regular applicant. So they'll
Okay.
just complete the application and see what the eligibility will give them at the end. Because remember, even if they're within the tribe or not, it's still by what their financial information is first. That's the first
Okay.
thing. The
Okay.
the ones with the that are with the recognized tribe, it was the premium care. I'm sorry, the monthly premium and the copays that would some of them would not have to pay that. They didn't have any information in terms of for those who are not part of those state ones, if they will not be given that same, if they will still give that same special treatment or not.
Okay. So regardless of tribal status, let's say, so if there's somebody who's not part of a federally recognized tribe, this all gets determined based upon your income anyways.
Mm-hmm.
Correct.
Okay.
Yes.
Okay. All right. Thank you for that. And then in terms of the January 31st, I keep hearing this date as well. What is that date reference to in terms of open enrollment?
Because sometimes they could go to that. Actually, oh, am I still in 20? We're still in 2020.
Yeah.
So earlier this year, that's exactly what ended up happening. They were given the January 15th actually is when they went to, and then they extended it to February. So that's why I said it's circumstantial with them giving an extension.
Okay.
So the 31st sounds just right on point with that, and we wait to hear because we get the information too sometimes at the last day or the appointed day to inform us if there's going to be a change in the date.
Okay. So right now, though, it's just December 15th. That's the date.
Yep. If they want to get coverage right away for January, if they don't make it for the 15th, you can still enroll, remember. Just
Okay.
that the coverage start date will be February.
That's right. Okay, great. Thank you. And then for those that do make more than that federal poverty level, which I think you said was less than $25,000, is that correct? So
Correct.
for those who do make more than $25,000, what are their options?
So their options is the qualified health plan. And those
Okay.
goes into the plans where it's silver, bronze, platinum that they will pay. The premiums are higher and the copays as well.
Okay. All right. But there's still options for them.
Yes, there's still options for them. And if, like I said, there's also credits for some that if the plan is too high and let's say they have children, that also your household size also determine where your income so how much they would charge you because someone has kids, they may get the tax credit. So the tax credit will assist them in making the payment for their plan.
Okay, great. All right. And let me see. Are there any other questions in the chat? Let me take a look. All right. And Austin, did you have a chance to see if anybody came through with questions on our social media platforms by chance?
I have not seen any come through yet, but if anything else pokes through in the next couple minutes, I'll definitely let you know.
Okay, great. Thank you. I guess the last question I have then for you all is, you know, in terms of like, let's say everybody misses this open enrollment period, is what can an individual do to sign up for health insurance? Is that something that is allowable, or is it stop at a certain date and then you can't sign up? I mean, what's beyond
sign up.
these deadlines?
They can still call
They
and sign
can.
up, as I mentioned at the beginning of the presentation. So Medicaid recipients, Child Health Plus, and anyone under the essential plan, they can sign up at any given time. It's just this coverage start date. We're trying to get people to understand that there's a gap in it. And so you want to do it early. And for those who are into the qualified health plan, as I mentioned, who are over that 25,000 to 30,000 threshold, that is the people that are I want to say has to be quick to get into the plan, because once they close, then they are not able to enroll at any time. They can only
Okay.
enroll during the open enrollment period.
Enrollment
Once
period.
they close it, they cannot. They have to wait until the next enrollment period. So it's, we're saying January 31st, for instance, maybe the final cutoff. They will have to wait until November again when it opens back up if they don't
I
enroll
see.
before then.
Okay, so those are the people that really need to take the deadline seriously.
Yes.
Okay. All right. Well, Shanaleigh, I don't have any other questions. I don't think we've had any other additional questions coming through. So I just really want to take a moment to just thank you and Marcia again so much
Welcome.
for taking the time to provide this presentation and the information about open enrollment, health insurance. Again, you know, the number, I'll just read it out aloud again. Marcia's number is 646-418-8568. And Shanaleigh can be reached at 917-699-3318, as well as you have two other team members, Diamond Walters, who can be reached at 646-771-6870, and James Rivera at 917-882-1368. I just, again, want to say thank you so much. And if you have any last words or pieces of advice for our listeners, or if you just have a comment that you want to say, please feel free.
Well, the only comment I have is I would love for everybody to get health care. And the only way it can be done is getting health insurance. So just call one of the numbers here and we are there to help. No matter who you think you are, just call us and we will make that determination. So that's all I can say. We're trying to reach everybody living in New York City or New York State who has no health insurance. So yeah, thanks.
Thank you, Marcia.
Yeah, so that I also want to agree with the Marcia, but also just sharing. Remember, anyone who loses their job, there's still some people that are still losing their
Correct.
employment. So this is for you as well. If they're telling your insurance is going to end, perhaps you only have 1 month left of the insurance that the company is going to give to you. So you need to transition into finding your own insurance. Same thing. This is why we are here to assist you. Even small businesses as well. They have, you know, small employees that are like 10 or less, or what have you. They can also apply so that we can assist them with the health insurance. So since we have both options with state and city, there's not much that you can't really get help with, because as you were mentioning just now, I believe, Jared, in terms of the income, right? Even let's say they missed that deadline of the 15th or in January, they can't apply with the state, but they can apply with the city, because the
Yeah,
city's not going to turn them down. So that's also
correct.
something that they need to have in their mind. We have two resources. You can get into them. So share the information with family and friends. The fact that we are still having, to me, even going to the doctors, and you're still seeing on applications that people are not having insurance, or you're hearing people are going and they have this big amount of bill because they don't have insurance. We definitely want to take away all of those anxieties, all that cost right now in this time. Every penny counts. We do not want medical for you to be thinking about food or your medical bill, so that you can provide for your family. So we need them to know that there's enough resources out here to assist them. And of course, we will try our best so that they can get all the services that they need. So please just go out into the community and share it with everyone.
Thank you,
Thank you so
Shanaleigh.
much
And
for
we will
having us here.
Yes, Shanaleigh, and we will definitely be posting this on our YouTube page, so you can find this information there. And you know, I'd love another opportunity to speak further about health insurance. So if you all ever have some more time, maybe next month we can do a follow-up or a part 2. I would love the opportunity to do that. And again, just thank you so much, and thank you for all the information. And from myself and from all of our team here at UIC, I just want to say, everybody have a wonderful weekend. Thank you so much. And
Thank
we
you.
look forward to talking to you again.
Thanks. Thanks.
Thank you.
Bye.
Bye.